Hello. Oh, you can't see me. Jesus. Hello. So I'm gonna be doing my Foley catheter video. I have my 2 towels as my legs, and then I'm just gonna be using my protein bottle as the insertion point. And so I'm just gonna go for it. So I'm gonna introduce myself to the patient. I'm gonna verify orders, also perform hand hygiene, and then I'm going to check the wristband to make sure that it is the right patient, and I will go ahead and get everything set up. So I'd come around to the patient, I'd lift up the gown, provide pre-peritoneal care before I even begin setting up my Foley catheter kit. So I would provide the peritoneal care. There we go. Pre-peritoneal care, as well as just kind of inform my patient of what's going to happen and why it's going to be happening. So yeah, I would just let my patient know that it's going to be a little bit of pressure. So I'm going to start undoing my Foley catheter kit, and I'm going to just be grabbing the corners, the 1-inch margins to maintain a sterile field. Alright. And then I'm going to take my and then I would just lay it down and position it correctly. We're not doing a guide, so I don't need that. And then I would don my sterile gloves, which I'm going to use these instead. Oops. Then I'm going to fix them because they look messed up. Alright. And then I'm going to go ahead and get everything ready. I'm going to start by moving my box. That way I can have a dual space to work with. I'm going to go ahead and put the lubricant in the corner of my box. And then I'll be done with that. As well as I'm going to open my 3 iodine swabs and place them in my top tray. Then I'll be done with that. And then I'm going to go ahead and remove the catheter part from the bag, and I'm just going to wrap it around my fingers like that. That way it doesn't flop everywhere and get unsterile. Then I'm going to just put the tip, and I'm going to inspect the tip and make sure that there are no deformities or there's no breakage or anything like that. And then I'm just going to place it in the lubricant. Then I'm going to take my flush and I'm going to go ahead and hook it up to the port. And now I'm ready to move over to my field. So I'm just going to do that with my swabs. And I'm not going to turn my back on my sterile field. So then I'm going to place it, and then I'm going to use my non-dominant hand and spread the labia. So I'll spread the labia and then take one of my 3 swabs, and I'm going to first swab the labia farthest from me. So in this case, I'm going to swab her right labia. So I'll swab it from the top down, and then I won't cross over my sterile field. I'll just go around and place it. Then I'll do the left side, and then lastly I'll go down the middle, which from the top down, and then leaving my non-dominant hand as the to hold placement. So now I'm done with that portion. So now I'm going to insert the Foley catheter, and the way I'm going to do that is I'm going to take my the actual catheter, and I'm going to just thread it in. I'm not going to use my left hand to touch any part of the vagina, just because it will then become unsterile. And as I thread it in, once I see flashback, once I see urine come through the tube, I'm going to take my non-dominant hand and just or excuse me, I'm actually going to advance the catheter for a female. I'm going to advance it 1 to 2 more inches, and then for a male, I would advance it 3 to 4 more inches. Then I would take my non-dominant hand and hold placement of the catheter. Once I have placement held, I'm going to then insert the flush and then take it off. And then lastly, I'm just gonna pull back a little bit to make sure that it's placed correctly and that it won't fall out. And then with the Foley catheter bag, I would then take it, hang it on the bed. Well, actually I would take my gloves off, take the Foley catheter, hang it on the bed. I would document how much output there is, the color, and if there's any odor or anything like that. And so then the insertion part would be done. To remove the Foley catheter, it is not a sterile procedure, so I wouldn't need to don on any sterile gloves. I would just put on a fresh, clean pair of gloves, and I would come into the room with a sterile syringe, 10 cc syringe, and I would also bring an extra towel with me. And the point of the towel is to keep my area from making a mess. I wouldn't want for the patient to have a big mess on her. So I would then take my towel, or take my 10 cc flush, hold placement with the Foley catheter, and then I would hook the flush back onto the port, draw back all the fluid that's in the balloon catheter, and then ask the patient to bear down and tell her that it will be a little bit uncomfortable, and then just go ahead and pull the catheter out. Once I pull the catheter out, I do need to inspect the tip to make sure that 1, nothing is broken off of the tip, and 2, make sure there's no blood or discharge or anything of that nature on the end of the tip. That way we know we wouldn't have to do anything further for the patient. After that, I will just provide post-peritoneal care, clean up the area, make sure that the patient's okay, and then I would be done. And that is how you insert a Foley catheter.